Hi, everybody. My name's Andy. I'm a psychosexual and relationship therapist registered with COSRAT, who are the College of Psychosexual and Relationship Therapists. I'm joined today by Dave, who's very kindly offered to share his experiences of having a partner with prostate cancer and how this can impact on relationships. He'll be asking me some common questions about sex and relationships. So to start, I'm going to ask him to introduce himself. So David, I'm just wondering if you could tell us a bit about yourself, your partner, when he was diagnosed, what his treatment has been, and how this has affected your relationship.
Sure. Thanks, Andy. Good to meet you. So I'm Dave. So I'm 53. I live up in the northwest in Lancashire. Scott and I have been together for 20 years this year. And it was just the back end of 2023, so December, where Scott had a confirmed diagnosis of prostate cancer. He'd been to the doctors a couple of months before about something totally unrelated and just asked at the time whether it was worth getting a PSA test done. And the doctor agreed. And within weeks we had a result back saying his PSA level was higher than it should be. So went through the normal process of went for another test, went for the digital rectal examination, and then went for the biopsy and the scan. And then I think about 5 days before Christmas, we were called in to see the consultant, and he confirmed that that Scott had prostate cancer. So from that point, we were kind of over Christmas, just kind of waiting to hear what the plan was. We had the sort of, well, a few different discussions lined up with the different doctors. One was to meet with a doctor who, if Scott chose the option, would do the prostatectomy surgery. The other doctor was there to talk us through the radiotherapy option. And then Scott was given some time to, once he'd had those consultations, to think about which option was best for him. And he chose the prostatectomy route, having sort of understood kind of what that meant physically and so on. And then his surgery was in May last year, May 2024. And the surgery all went to plan. I think everything kind of worked in exactly the way it should have done. We're still very much on a bit of a journey in terms of the impact that that's had and so on. But Scott's now healthy. Obviously, he's cancer-free, which is amazingly positive. But there are things sort of bubbling away in the background that have kind of led to some frustrations for us.
Okay, great. So I know you've got some questions that you want to ask today. So
Yeah,
yeah, let's go.
cool. So I suppose the first one is, I mean, when we met with the doctors originally and we were, we listened to all the sort of the potential sort of recovery time for prostatectomy surgery. I don't think at that point we kind of realised the way that surgery might impact on our sex life. The doctor had said to Scott, probably within a year-ish, you might, everything might well be back to normal. And I think it's been a really difficult thing for kind of Scott to deal with in terms of nowhere near back to normal at this stage, and this is sort of months down the line.
Yeah.
And I think from my perspective, I feel kind of helpless in terms of what I can do to support him. I'm not there going, or demanding sex every night or week or whatever. But
Yeah.
I think Scott's very conscious that, that part of our life is missing very much. And I don't know what to do to support him through that and help him feel better about himself and what's going on.
Yeah. I mean, I think that's one of the really difficult things about something like a cancer diagnosis is that there are often unknowns, and we want to have answers and we want to know what the future holds. And unfortunately, I think with some of these treatments that affect things like erectile dysfunction, um, they can be more permanent, but very often they are kind of temporary and can be worked with. So have you had any kind of experience of therapy or seeking any tools or support
No, nothing. I mean, I know Scott has various gadgets and pills to take in terms of, improving circulation,
Yeah.
and so on. But there's been no therapy at all offered, as far as I understand it, in terms of helping Scott through this at this stage.
Okay. Which is a shame because there are a lot of things that can help people gain confidence in their erections, and lots of tools and techniques that we use in therapy to help people with erectile dysfunction. Um, so uh, I guess what I would say is in terms of desire, where are you both at the moment?
So I suppose for me, there's a reluctance to even express any sexual desire because what I don't want to do is feel like I'm putting any pressure on Scott to do anything or to perform or to get an erection or maintain it and so on.
Mm,
And I think Scott is very much in that place of it's still a very private thing for him to deal with. So
sure.
in terms of much sexual interaction between the two of us, there's very little.
Yeah, yeah. So I think what I would suggest in these kind of situations that I think are quite common is kind of exploring other ways of intimacy that don't involve kind of the pressure of sexual activity.
Yeah.
So one of the techniques that we use in therapy is called sensate focus. Not sure if you've heard of that
I
before,
haven't,
but
no.
it's a technique that runs in stages, which kind of takes sex out of the equation and is much more focused on intimacy, so touch and exploration of pleasure, what you enjoy, what your partner enjoys, massages, that kind of thing. And I think that that's really important because you want to stay connected and you want to retain that intimacy. Even though you may not be able to have sex at the moment, there are lots of different ways that you can help stay connected to each other, and even things that aren't necessarily, intimacy in the bedroom, like kind of holding hands or cuddling or, sharing a favorite activity together. Those kind of things I think could be really useful in helping couples stay connected whilst they're going through this journey.
Okay, okay. And Andy, I mean, in terms of, that's kind of ideas about the physical side of things. What about the sort of the emotional side of things for Scott? So how best can I support Scott, on the journey that he's on at the minute with without me focusing on the sexual side of it, if you know what I mean, that sort of that emotional support so that he knows actually all of this is okay and it's not going to damage our relationship.
Yeah, yeah. So I think that that's a really useful thing to say in terms of how you wish to support your partner, and it could be that you sit down with each other and share kind of your fears, your anxieties, your hopes, what you would like from your relationship at the moment. What tangibly can you both do for each other, to show that you're supporting each other, to give each other kind of that sense of self-worth and well-being that I think is really important when you're going through, what's clearly a really difficult journey.
Okay, okay, thank you. And then I suppose one of the big things that's come up for Scott is obviously, he can still orgasm, he can still have that sensation, even though I think for him
Mm,
it feels very different. But obviously
mm,
it's a dry orgasm
mm,
because of the impact of the surgery. And that for Scott is quite a big deal. Um,
mm.
how does anyone make someone feel better about that?
Yeah, I think, we tie our sexual identities so intrinsic within ourselves that when something happens through something like prostate cancer treatment where there is dry orgasms, that can really impact someone's self-esteem and self-worth. So, I think it's what I would ask is he still retaining some pleasure from orgasms? Are you still able to enjoy some activities? Because sometimes it is about kind of reframing how we view ourselves as sexual beings. And actually, although that can be seen quite negatively, I would also say we can see it as an opportunity to look at what other things do we enjoy. So as a therapist, I will often say to people, what do you want from sex? What would you like? And what's reasonable to expect from your partner and from each other in sexual activity?
Yeah. And I suppose we've not explored that at all, Andy. I mean, I suppose uh, whilst we've not talked about this in great detail, I think what we're kind of both expecting to a certain extent is what there was before, and even
Yeah.
if I'm not talking about penetrative sex there, I'm talking about everything else besides that. Um,
Mm.
and obviously it's very different now, because of the physical impact. So we've not really talked about actually what other aspects of sex or what can we do differently that we still enjoy as much, even though it's different.
Yeah, and I think that's something that, I would encourage you to explore. So one of the tools I like to give people, very mindful of the fact that not everyone comes to therapy with a, huge knowledge of how to communicate emotions and feelings. So I like to be quite simple sometimes with some of the techniques I give. So one of the things I like to ask partners to do for each other is have a weekly check-in, and it's a space, maybe half an hour once a week. All phones are off, all television, music, everything's off, and you sit down and you talk to each other about how you're feeling. And I might, if people ask, throw in some questions that are helpful, like, what's going well for you at the moment? What isn't working so well at the moment? And how can I support you at the moment? Questions that you ask each other to kind of gain a greater understanding of where you're both at emotionally and how
Yeah.
you can support each other. And I think you can incorporate, discussions around sex. What have you been doing that you've enjoyed, or what would you like to do that you're enjoying? Are there things that you can do solo? Or are there things you can do together to kind of give yourself a more fulfilling sexual experience?
Andy, you talked about the idea of weekly check-ins in terms of sort of improving communication. Is there anything else in terms of that, those check-ins or communication that you would suggest to kind of maintain and improve relationships?
Yeah, yeah. So I'll talk about a technique we use in therapy called reflective listening. And it's quite a different way of communication, because often when couples are in conflict or they're arguing, one person is, making their point, and the other person is maybe listening to the point, but also formulating their response. So not truly listening to what the other person has to say. So I find reflective listening a really useful tool to use. So what we do is we call one person the sender and the other person the receiver. So the sender will talk about what's on their mind or what the problem is and how they see it. And what the receiver does is they are just listening. They aren't formulating a response. They're just listening to what the sender's saying. And when the sender has finished talking, what the receiver does is they then paraphrase back what they have heard the sender say, and then they talk as what they've heard, and then the sender confirms whether that's correct or whether they've missed anything. And this is actually a really useful technique to use in terms of communication, because it allows people just really sit and listen to their partner's needs, without kind of that formulating response. So yeah, I think reflective listening is something that can be really helpful.
That must take some discipline, Andy, though. I mean, knowing us
Yeah,
about sometimes, the heated debates you get into, your automatic response is just to think, how am I going to fight back? How am I going to,
yeah,
find a point to argue with? So that must take
yeah.
discipline in terms of just getting into that sort of train of thought. And
Yeah, so
that,
I guess like many things in therapy, what we kind of ask couples to come with is commitment to the process.
yeah,
So um especially when techniques like this aren't part of the relationship, they definitely take some work. And because it's a new way of communication, it does take some time getting used to. But I find it really effective. And I think as couples quickly begin to see the changes in how they communicate and listen to their partners, that actually it just becomes incorporated as part of their day to day. And yeah, it can be really useful.
And then, Andy, one of the things that kind of always pops into my head, and I mean, this isn't a real thing for us just now, but it kind of worries me in terms of, the longer this goes on, and, I know that Scott's conscious of the fact that we've not got the same sex life as we had. And whilst he knows that I'm not out there looking for sex elsewhere,
Mm,
it kind of worries me that there might become a point where he starts to feel quite insecure because we've not got what we once had. Um,
mm.
how would you suggest people deal with that sort of insecurity in the partners in terms of having had an experience like this?
Mm. So I think that's really important to validate your feelings and explore them together. And when things like jealousy or insecurity come up, it's very easy for them to become major sources of conflict. So what I would suggest in that situation is when you're talking to your partner, instead of using statements that kind of apportion blame to the other, like you are making me feel or you've done this, it's really useful to kind of take ownership of the statements and say something like, I feel like this because and that's a kind of really useful way of being able to explore those kind of feelings without kind of apportioning blame. But I'd also go back to, the importance of, sharing intimate moments together that aren't just solely related to sex. So I don't know if you've tried things like massaging or sensual touch or things like that, where again you're clearing a space, an evening that you can spend together without the pressure of having sex. Take sex off the table sometimes, because when you've got that pressure of needing to have sex, then actually that can impact on you enjoying the moment. So
Mm.
sometimes it's quite useful to kind of say, right, we're going to have an evening where, we cook some nice food, and then we're going to get some nice massage oil and kind of lie each other down and explore each other's bodies through touch and sensations. And that's just a way, I think, of connecting intimately without focusing on sex.
Yeah, okay. And Andy, sort of, I suppose thinking into the longer term, I mean, obviously, Scott's still on that journey physically in terms of hopefully things will start to improve for him and
Mm,
us. What's your experiences of working with people or supporting people who this has been a really long-term challenge for, whilst when we were first talking to the consultants, they were saying, give it a year and things will start to return to normal and so on. But what if it doesn't? How do you look to the future in terms of then what that will bring to the relationship?
Okay, so I think that that's a really useful question to ask because we are aware that there are lots of things that can help. So help improve erections or help increase pleasure if someone is having dry orgasms. But what does happen where the normal sex is off the table? And I think what I would seek as a therapist is to explore in much greater depth, David, is about what can you enjoy together? What is it about sex that you still find pleasurable? So I think sometimes there are some great things to explore that maybe haven't been on the table. So in my mind, I'm thinking the various erogenous zones. So, the neck, the back of the ear, the inner thighs, the pleasure that we can gain from that. So even though sex might look differently to how you had hoped it would look, that doesn't mean that sex and intimacy can't still be really enjoyable.
Okay. Thank you, Andy. And I suppose the last question for me really is I suppose it goes a bit wider than sex, and that's around the fact that having gone through this experience, it's obviously affected Scott and it affects sex life and so on and so forth,
Mm,
but it's quite clearly had an impact on his general outlook on life, I think. Um, how do you kind of detach the two, I suppose, if you can, to kind of help him stay positive about everything else in life, even though that one aspect of his life is obviously very different.
mm. I mean, I would like to explore kind of where those feelings are, because sometimes, we like to talk in therapy about what we call negative automatic thoughts. So when we're finding things in life difficult, we often feed ourselves negative scripts, which have an impact on our self-worth. So quite often partners might say, I worry that my partner doesn't love me as much, or I worry about the fact that I'm not a sexual being anymore and I'm going to be looked at differently by my partner. And I think, you can help to reassure your partner. I think that, your relationship is based on many different facets of enjoyment, such as his personality, his sense of humor, his interests. These are the things that make, good relationships. So I don't know what your experience is so far in terms of kind of helping him um, improve that sense of well-being and self-worth.
I think, what I've tried to do is just maintain life as normal, and
Mm,
and make sure that where we can, we enjoy different experiences, as basic as going out for coffee and cake and meals and night
mm,
and so on and so forth, just so that I'm not feeling like life generally has to change. Um,
mm,
but sometimes I kind of feel like I'm not doing enough um, to make sure that we're kind of making up in the rest of his life for what's missing in the other part of his life. Do you know what I mean?
mm. And have you asked him, is there anything more that you need from me?
We've had conversations about it, and and I never get back, I suppose, that I could do anything differently or whatever. It's just that sort of feeling I have of I should be doing more.
Yeah. And I guess from his perspective, these feelings are valid and that certainly real, and you can understand that this is a really difficult situation to go through. So I think it's really important to acknowledge
Yeah.
when we're going through difficult circumstances that sex isn't what it used to be. I don't feel like I did before, and there is an emotional impact on people when that happens. But I think what you're doing is really important by seeking to offer him support and help him with his sense of well-being and self-worth. Yeah.
Okay. Okay. Thank you. I don't think I've got any other questions, Andy.
Oh, okay. I mean, is there anything that you feel you wish as a gay couple you've been told earlier on in your journey that would have prepared you better to cope with your partner's diagnosis and the sexual side effects?
So I kind of I feel like it would have been really useful to have a much more in-depth conversation with, a professional like yourself, Andy, around actually how we navigate some of this journey, through the first 6, 12, 18 months and so on and so forth, because I I kind of feel like there was just something missing in terms of that support for us.
Mm,
There are local groups around where we live in terms of, just general support groups of people who have or are affected by prostate cancer. Um,
mm.
but, they're generally not full of gay men,
Okay.
and whilst that's not me saying, my experience is different to the wife of someone else with prostate cancer. I just kind of feel like some of the discussions might be different. But also, you generally wouldn't open up about, talking about a gay relationship in that sort of scenario. So I
Sure. Yeah.
kind of feel like there's been something missing in terms of helping us understand some of the nuances that we've kind of encountered through this.
And have you heard of, there's a charity called Metro Charity who run a group called Walnuts. Have you heard of that before?
Oh, we've heard of Walnut because there's a Walnut group near us.
Oh, okay. Yeah, yeah.
Yeah. Yeah.
Oh, yeah. There's one in Manchester, I think.
I think there's one, well, I'm sure this is the same one. It's one in Preston.
Oh, okay. Yeah.
Yeah. But there is
Uh,
another group in Manchester I know Scott's been to. Um, but yeah. But I think that's it for us. It's just, I suppose, having a better understanding at the start of, how we kind of support each other through it, would have been useful.
yeah. And I think it's what you highlight is really important that as gay, bi, or men who have sex with men, our stories are unique. And it is important to get the right level of support that's aimed at us, because I totally understand that if you're in a space that isn't for gay men, then it can feel more difficult to kind of share your experience and your story, particularly for instance, the loss of prostate sensation and anal sex. Then actually that's really important to explore. So there are organizations available. So I know Prostate Cancer UK have a forum on their website for LGBT people. There's the Metro charity. There's GMFA. There is lots of kind of specific support out there that I think is really important to use in kind of our situation.
So Andy, there was one thing that came up in conversation with a colleague a little while back, and that was around people who are in open relationships at the point when one of them is then diagnosed with prostate cancer. And obviously, understanding now the impact of that on that one person physically. How do people in open relationships then kind of navigate that journey in terms of the way, each of the partners might feel about the impact of that cancer?
Yeah, so I think, if a couple have an open relationship and there are going to be changes to that relationship, firstly, I would like to kind of explore how they navigated the kind of openness of the relationship in the first place, or we call it ethical non-monogamy. So, what structures did they put in place to kind of ensure that both parties feel safe in that open relationship? Is it something that's very flexible? Is it something where there's structure to it? Because obviously a diagnosis or a health change can impact on how they navigate that open relationship. And I do think it's really important that couples sit down and speak to each other about what their fears are about the changes in that open relationship, what they think is kind of acceptable within the parameters of this new open relationship. And really what I think needs to happen is that both couples feel secure within themselves about kind of the new open relationship that comes from post-treatment.
Okay, thank you. I don't think I've got any other questions, Andy.